Hi, welcome back, beautiful beloved souls. Today I want to talk about buprenorphine. Now, I've talked about buprenorphine before. I've told you that I'm on Buvidal, and this is a little bit different. I don't know very much about this except that it is like I said, buprenorphine. It's a Sublocade Buprenorphine long-acting injection used to help people aged 18 or over stay off opioids such as heroin and morphine. It is also used with social, medical, and psychological help. Buprenorphine also comes as under-the-tongue tablets, film tablets, and another long-acting injection, Buvidal. So, I'll leave this up so you can have a read, and while you're reading it, I'll tell you what it was explained to me. Now, for those of you who know, I'm on Buvidal injections. It was just recently put up to 600 megs, and it was monthly. And I always thought, and I am now going to correct myself, that it formed a gel. No, that is incorrect. It goes into the subcutaneous, either into your arm, into your stomach, or upper thigh. We're talking about Buvidal here. And Buvidal, when I said 160, I should have said 160 megs. And only at AOD, AOD stands for Alcohol and Drugs Centre, can you get the 160 milligram. In Australia, the doctors only go up to 128, that maxes out. But this buprenorphine is different. So what you usually start with, and I'll read it. Apparently, Buvidal, I thought was a gel. I thought that it went into your stomach as a gel, and apparently that's not quite right. It's just thicker. It's this buprenorphine that goes in as a gel, and only the buprenorphine can only be in your stomach. So it actually forms a gel, and I'll just read what it says. Sublocade Buprenorphine long-acting injection. I've said that is used to help people. What is the usual doses of Sublocade Buprenorphine prolonged release injection? The first two doses of Sublocade are 300 meg. If you are settled on this dose for 2 months, you may be able to change to 100 to 200 megs a month. And it says, how should I have buprenorphine injection? The Sublocade injection is given by a health professional just under the skin of the abdomen, stomach area. You should leave a gap of at least 8 weeks before having an injection in the same place or site on the skin. And said, when should I have this? You must have at least 8 milligrams of buprenorphine tablets for at least a week before you start, to make sure you can tolerate it and don't get too many side effects. This is because having buprenorphine would trigger withdrawal symptoms. There we are. So what are the alternatives? The main alternatives are methadone and buprenorphine as a tablet. And apparently they say, see our handy chart for opioid dependency to help you compare the medicines available. Talk to your doctor, How long will buprenorphine take to work? The injection starts to work in 12 to 24 hours. The effect peaks at 24 hours. From my understanding, this is a better alternative because once you have the injection, you can't have another injection for 26 days, and so it's longer. So with my Buvidal, I can have one within 3 weeks, that's 21 days, stretched out to 6 weeks. But this seems to be, let me read exactly what it says. The injection wears off slowly, and so it can be stopped fairly quickly, but slower may be better for your long-term health. So how long will I need to keep having buprenorphine for? Usually for at least 3 months, but could be around 6 months or longer. I was told today that my Buvidal, which is a different buprenorphine injection, that I could actually have it for the rest of my life. Because AODS only deals with dependency and addiction, they're not really pain specialists, but many of their patients are pain patients. So many people come to AOD, it's now AOD under the Queensland government, and AOD now is stands for alcohol and drugs, and talking about this Sublocade, which is different to Buvidal. Okay, so we're talking differently. The Sublocade can only go in your stomach. The Sublocade does form a gel, and because it forms a gel, it is better at slow release of the drug. Okay, so here we are. What should I do if I forget to have a Sublocade injection? There must be at least 26 days between doses. That's because within a set time, it reaches a certain level and, like I said, is slow release. And then it says the monthly injection can sometimes be given up to 2 weeks after the due date. If you decide to switch to tablets, you should wait a week after the weekly injections or 4 weeks after the monthly injection before starting taking tablets. This isn't very important. Can I drink alcohol while I'm having buprenorphine? Alcohol and buprenorphine together can be dangerous and can lead to overdose and death. A glass of wine is unlikely to be harmful, but more could be dangerous. Now, this I will read to you because you need to know this. Buprenorphine affects my other medication. Buprenorphine has a few possible interactions with other medicines. The main one includes you may overdose if taking other medication which can cause drowsiness, such as opioids, pregabalin, which is Lyrica, benzodiazepines, which is Valium, antihistamines. I take an antihistamine at night. I take Phenergan, antipsychotics, and antidepressants. You may need a dose change if you take carbamazepine or other treatments for HIV. Your dose may be need to halved if you take ketoconazole for fungal infections, and you can get serotonin syndrome, flu-like symptoms with some antidepressants. So, yes, So let me repeat this. This is different to Buvidal. Now, it may benefit me to go on to this new one. The reason for the sting, and this was explained to me very, very well, whether it is Buvidal or Sublocade. The reason for the sting is any body or any foreign body, by foreign body, we're looking at the injection here, that is introduced to the body that is not of the same consistency of blood will cause it to sting. The higher the amount in the injection, the more the sting. So basically, if you are on Buvidal and you lived in Queensland, there's not very many doctors who are doing it. They should be, because this is a marvelous way to manage pain without opioids. And you can be on it for life. There's a lot of people who aren't, but there's a lot of people who, like me, will treat AODs as their pain specialists. So I'll just have a look. Let's go through side effects, which are very common. Headaches. Your head is pounding and painful. Nausea and vomiting. Feeling sick and being sick. Hyperhidrosis. Sweating. Feeling hot and sticky, particularly at night. Let your doctor know. You might need to change your dosage. It's not dangerous. Also, insomnia, not being able to fall asleep at night, pain. Well, I told you that can be at the site of injection or general pain. But before I continue with other side effects, the pain is like a bee sting. It is with Buvidal. And it lasts maximum 5 minutes. Usually it's all over within a couple of minutes. You can request a ice block to put on your skin before you have it. All right, let's keep going. Other very common side effects: a lump under the skin, a swelling under the skin where the injection was given. Don't rub it. Do not rub the injection site. And you can have withdrawal symptoms: shaking, chills, nausea, and the runs. So that was very common. Let's look at common side effects: constipation, sleepiness, fainting and dizziness, meiosis. Meiosis is pinpoint pupils, and sexual dysfunction, male ejaculatory failure. Rare but important allergic reaction: wheezing, difficulty breathing, swollen eyes, swollen face, swollen tongue, lips, throat or hands, itching. Dial 000 if you live in Australia. Dial your emergency number for whatever that country is and get emergency help immediately, because that allergic reaction can be dangerous. I'll just shut up for a minute and hold this here. So, sorry, I've already read that out. I'll let you just have a read, if you can read it. I've already said these things anyway. Now, as always, please seek medical advice. I am not a nurse. I involve nothing to do with the medical field. I'm just a patient who has now been on Buvidal for over 4 years. The nurse who I was talking today thinks that I would actually be better off on this other injection, this Sublocade, because you can stretch out the times. If you're going to constantly need an injection, you can stretch it out longer because, as I said, it forms a gel and it's very well controlled, where Buvidal might not be as well controlled. I thought it was a gel, but it's not. It is like honey. It is dangerous. If you try to inject Buvidal or this Sublocade, you are at risk of a clot. That's why in Australia, patients don't handle this, because if they imagine, there are some silly people out there, and silly people will try to inject it, and next minute they're dead because they've just injected a massive clot. All right, my name is Gem Stone. I'm a psychic medium and an author. I appreciate every one of you. If you have questions for me about Buvidal, I will try to answer them. Let me just review this. Buvidal and this Sublocade are two different types of injections of buprenorphine. Okay? So that word there at the top left-hand corner, they are two different injections. The Sublocade, you wait 26 days, where Buvidal is 21 days. Both can stretch out to 6 weeks. And Buvidal, you can also, my understanding is Sublocade is for a month. So the differences is Sublocade, you can only have it in your abdomen. Whereas with Buvidal, you can have it in your upper arms, your upper thighs, and your abdomen, in your fat cells, in other words. All right. Yes, if you have a question, please drop a comment below. And always note this. They say this, and I'm going to end on this. If you use on top of prescribed buprenorphine, only take a small amount, especially if it looks different to normal, and wait to see how it affects you before taking any more. Smoking is safer than injecting. Avoid using alone. Be with people you trust in a safe environment and have access to naloxone. I'll spell it for you. Naloxone if you can. All right. Thanks, beloved, beautiful souls. And let me know how your journey is going, because, you know, America is different again to Australia. I live on the Sunshine Coast, Queensland, so our rules, our dosages are all different. Let me know. I'm a person who likes to learn, and I love to share what I learn. And this is about all facts of life. My videos cover everything and anything. All right, take care. Take care of yourselves and each other. Love, light, and blessings.